there, they were on my list.
Good. Good.
So it's been great doing it over these 20 years.
Good. Well, thanks for that, Chuck. So everyone, I just want to welcome everyone to the presentation. It's going to be a presentation with a slight twist. We're not going to. You may accuse Dr. Allen and me of many things, but it won't be death by slide because we're not going to use them. So we'll see how it goes. But the idea is we've got a number of questions that he and I are going to go through, and again. Uses kind of very much of a freewheeling approach. And again, I think we're very privileged to have Dr. Allen talking about his many years of experience in the industry, as well as his practice, and then how he's integrated the test into his practice. And there's a number of you who've used the test and have appeared or listened to these webinars. That's really the focus of them, is to get some of the fantastic providers that we have out there running the test, talking and sharing some of their experiences, kind of types of patients they use it on, supplement protocols and things like that, to give you some real life experience. Again, I've never been a fan of having people who are good on PowerPoint and will tell you all about what they used to do, rather than the real practitioners that we've been fortunate to have running the test. And I include Dr. Allen as a key member of that crew as well. So without further ado, I'm going to hand you over to Dr. Allen. He and I are going to talk back and forth on this. And again, Dr. Allen, do you want to start by giving everyone a bit of a background on yourself, and then what was your journey into functional medicine, and then we'll go through that for a bit, and then we'll talk a little bit about your practice and where you're located.
Well, when I think about it, I'm kind of amazed at myself. It's been almost 50 years that I've been practicing medicine. So hopefully one of these days I'll get it completely right. It is a practice. I mean, and things change. I mean, we've gone through some times where people talk about, following the science, and it always kind of rubs me the wrong way because the science changes. The science is not fixed. We learn things and we move on from there. I started out in medicine as an obstetrician gynecologist. And from 1977 to 2000, I had a general OBGYN practice incorporating a functional medicine approach. So when James Bland started talking about, at that time it was preventive medicine, and even before it became functional medicine, I was following him and his ideas. I mean, and was fortunate enough during my obstetrical residency to work with several attending physicians who were into the mind-body effect, who were into natural childbirth, who were using things like garlic for infections. So, in obstetrical residency, you spend a lot of time all night just sitting around waiting for things to happen. And I was fortunate to be spending that time with practitioners who were thinking ahead. They were progressive thinkers. And when I went into my private practice, I started incorporating these same, these same techniques into my regular practice. In 2000, I had already been practicing 23 years. In 2000, the first integrative center connected to a hospital in this country was established, and that was at Beth Israel Hospital in New York. That was the Center for Health and Healing. And I was one of a dozen practitioners who were drafted, who were coaxed into bringing their practice into the hospital. And that's what I did. So I stopped doing obstetrics and surgery at that time, and I kind of devoted myself to an integrative approach to women's health care. I went back into private practice in 2003, and my practice has moved several times since then. I was first in Manhattan, and then we moved down to Maryland, and then we finally got permanently situated here in Westchester County in Rye, New York, where I've been here since 2008. And my practice is now not just women. I see men, I see children, and I see everyone who just wants to come in for a healthy aging protocol. So people who are feeling pretty good, but they understand that, the aging process can be, done in a better way. So we see these kinds of people, and we also see people, who have seen half a dozen to a dozen different practitioners for a chronic kind of problem that has no diagnosis. So we see the gamut of people who want to stay healthy, to those who have been sick for a decade or longer.
В принципе, я думаю, что да, там же не будет.
And what we see in all of these people is, the issues of inflammation and toxicity. So, healthy aging is all about reducing the toxic burden and, keeping inflammation at bay. These people who have been sick for decades, they're totally inflamed and they have a very high toxic burden. So these are the people I deal with. And it has been very frustrating, especially in New York. You may know that New York is the most restrictive state in the country in terms of doing functional testing. So it was about 8 years ago that they outlawed all food panels in New York. We were doing several varieties of them, measuring different things. They were helpful, not always, but they were helpful. And then, so we were reverting to an elimination provocation diet, and I usually start off any of these chronically ill patients with an 18-day cleanse. I figured 18 days was the best in terms of compliance. And we did an elimination type of a diet. So everybody got an autoimmune paleo type of a diet, kind of a Mediterranean style diet. And I'd say maybe about 80% of people did well on the cleanse, and 20% did horribly. They were bloated, they were fatigued, they had detox symptoms. And I didn't, really understand why until this fit test came out, and I started doing the fit test before putting them on the cleanse. And what I was finding is that many people were sensitive to either the detox powder that I was using. They had a green pea sensitivity, or they had a rice sensitivity, or something in the powder they were sensitive to, or a supposedly healthy food was creating problems, or they were sensitive to spices like turmeric. So these were people that, despite putting them on what seemed to be a healthy kind of a detox, they were doing poorly. So since we started doing the fit panel, we have almost, like I'd say, 95 or more % people doing very well with this 18-day cleanse that we do.
Alan, I was just going to interrupt you at that point. I mean, that's a really good segue in terms of, you mentioned the detox powder and some of the kind of healthy foods and spices. When we came up with the Fit 176, you'll see the additional foods down here in the red. And one of the things that we really came across, I mean, we worked with just over 400 providers to pull it together, but it was things like what are in some of those powders to make sure before the patients get put on them, then we can be thinking about that. So we added kind of things like goji berry, monk fruit, acai berry, stevia, and they're all in these powders. And so it's interesting you mentioned green pea. I've heard that before as well. So that was one of the aha moments we got from working with providers, which you've just kind of outlined there as well. And obviously we have a number of spices that we have in terms of even on our Fit 22, you hit it. I mean, the candida, the turmeric, and the brewer's yeast are even on that one. So it's fascinating that of the 20% of that you were having issues with, some of those things that hopefully now, as you said, were picked up on the fit test.
Yeah, and it's made a tremendous difference. I mean, if you were going to extend it even further, I would be adding things like xanthan gum and guar gum. These are all, additives, that are in many of these different powders. I mean, monk fruit is one of the major ones we see, sensitivity to, and, even people who are taking fish oils. So fish oils, coming from sardine or anchovies, And you have patients who have sensitivity to these fish, they can't use those fish oils. They're going to have a reaction to them. So the 176 panel, I find to be extremely helpful in picking up and Chuck said it, very well, that these things change, so when we're initially working with someone, we want to know what they're sensitive to give them the best chance of healing the gut. And that kind of segues me into the gut barrier panel, which I think to me is extremely important, and maybe the more important piece of this test, because when people have leaky gut, when people have increased gut permeability, there are always going to be some kinds of sensitivity reactions. And looking at these antibodies in the gut panel, gives you a degree. It shows you the extent of the leaky gut scenario. So, certainly if we have intestinal bacterial dysbiosis, bacterial imbalance. Now, the general medical community didn't really believe in this, until I would say the pandemic. The pandemic changed everybody's idea of what's going on in medicine. And all of a sudden, the microbiome became the major topic of discussion, and now we know that, environmental stressors like viruses or bacterial infections, will change that microbiome. I believe some of the initial work on the microbiome was related to people who had third-degree burns. So they had third-degree burn patients. There are studies, I think, from the 90s and before, were shown to have a malabsorption syndrome. So they were trying to treat these third-degree burn patients, and they couldn't get, they couldn't get the nutrients into them. And then they discovered that there is a microbiome imbalance that was creating the problem. So any stressor, mental, emotional, physical stressor, will affect this microbiome. And we see now beautiful evidence of that in these four indicators. So Candida, if we're making antibodies to Candida, the IgA, this is more the secretory immunoglobulin in the gut. IgG 1 through 4, C3d, this is looking at the entire immune system. So the immunoglobulins, I tell my patients, we make these. We can make hundreds of thousands of these, depending upon what we're exposed to. C3d is one of about 30 complement proteins that's related to the innate immune system. So we're looking at the adaptive or acquired immune system and the innate immune system in relationship to these indicators. So if we just see IgA antibodies, maybe it's still, the gut reacting to something. If we see the IgG and C3d, then we know that we've got, significant leaky gut. Zonulin is, so I explain to patients that the intestinal cells are like bolted together. The bolt between the cells is what we call the tight junction. Zonulin, I tell them, is like the wrench that starts unscrewing the bolt. So when we get increased zonulin, that there's a separation between the cells, and the occludin is the bolt. So the occludin, when that bolt is breaking down, we see this protein in the bloodstream, and the immune system is going to react to it. And then we have the lipopolysaccharides, which are components of certain potentially toxic bacteria in the gut. If it stays in the gut, it's fine. But when these lipopolysaccharides, which are what we would call endotoxins, toxins that we're making in our own body, when we get these endotoxins in the bloodstream, we're setting ourselves up for a sepsis, an infection, a chronic type of inflammation. So, I look at this as, a main indicator of where this chronic inflammation is coming from. And like Hippocrates said in 500 BC, life and death begins in the gut. This is where we have to go first if we're going to start helping these people to start feeling better.
Yeah, I mean, you make a great point. That, and I've heard it said by a number of providers, that the innate system versus, you know, the exposure as well, in terms of the different sides of your immune system. And again, you know, what I've heard them say is, look, you know, we love the fact that this is measuring the whole immune system versus half of it, you know, as opposed to when it looks at the food sensitivity. But you're right, when you talk about the gut barrier as well, you're moving from that, the IgA, which is clearly, as you mentioned, the secretory marker. And what we tell the providers is that that's localized in the gut. So that's the good news, it's early stage. As you say, more systemic when it comes across to this side. So yeah, no, it's fascinating. I like the bolt and wrench analogy. That's a really good one in terms of trying to make sure that that's clear to patients. And when we talk about, you know, the right oil from going into the body for the food sensitivities, but the bolt and wrench is perfect for the for those tight junctions, as you say.
Right.
You know, we talk about the zonulin and the function, and then occluding really the structural part of those tight junctions.
And this is something we could work on. So, I mean, you know, so, you know, initially we were talking about the 4R program for gut restoration, you know, remove, replace, reinoculate, repair. This came from Dr. Bland's work, you know, on gut restoration. So we want to remove the environmental stressors, you know, the foods that are driving this inflammatory process. Because once we have leaky gut, you know, the healthy gut bacteria, they do a lot of work for us. You know, it's not always appreciated, but you know, protein digestion. We start the protein digestive process with stomach acid and enzymes and chewing our food, hopefully. But it's the bacteria that actually break the amino acids out of the food protein. So if that's not working, we've got undigested food proteins sitting in that gut. And then when the gut is leaky, those food proteins are coming through that leaky gut wall because the bacteria, again, are maintaining that integrity of the gut wall. Now we have a third function of the bacteria that's not working, and that's education. So the gut bacteria actually educate the immune system, 70% of which sits around the gut just waiting to see what's going to come through. So if we get a confused immune system seeing these large food proteins, they think that looks like a virus or a bacteria. So they're attacking it. Yeah. And that's what makes us sick, you know. So you explain to patients that when you get a virus, you get COVID, it's not the virus making you sick. The virus is not giving you fever and aches and pains and brain fog. It's the immune system attacking the virus, putting out these chemicals we call cytokines. You know, again, this came from COVID, the pandemic, everybody talking about that cytokine storm. You know, so it's these cytokines that are driving the inflammatory reaction. So, you know, the imbalance in gut bacteria is eliminating all of these jobs that they do for us regularly. And so we wind up with a chronic inflammation from any of these foods now coming through the leaky gut wall. So patients say, well, you know, yeah, I have 12 foods here. I mean, do I have to eliminate all of them? And you know, you do. If you want to feel better, you've been to a half dozen physicians already, and they can't even give you a diagnosis. Yes, you need to eliminate these foods until your immune system will quiet down and we can heal the leaky gut. And then you could try reintroducing them.
So Dr. Allen, to that point, in terms of a couple of big topics there, kind of the reintroduction of the foods, and then in terms of the healing of the gut barrier, are there any kind of particular protocols or supplements you do in the healing of the gut barrier? And then also then talking about any supplementation that you found, you know, everyone's different, I know, but you know, that you've had the most success with.
Well, you know, there are many, you know, so there are a number of really good companies. And I know you work with Biotics and a couple of others. You know, I work with Biotics as well, and Designs for Health. There are a number of good ones. And most of their gut restorative powders or capsules are combinations of, you know, amino acids like glutamine, N-acetylglucosamine, maybe zinc carnosine, marshmallow root, aloe vera, cat's claw. So, I start with one called GI Revive. It's just one I've been comfortable with. It has all of these things in it. And then I use, one of the spore forming probiotics. So my feeling is that when you've got a leaky gut scenario like this and breakdown in the tight junctions, the acidophilus and bifidobacter that are in most of the routine probiotics are just not living there. If you take them, they may pass through and do a little bit of the work they're supposed to, but they're not taking up residence. The gut environment is just not conducive to that. So the Bacillus species, Bacillus subtilis, you see these in the spore forming bacteria. Megaspore is a good one. Orthospore is another one I like. The Orthospore IG from Orthomolecular has immunoglobulins in it. So that was also, extra help. So the spore formers, sometimes Saccharomyces boulardii, which is a beneficial yeast, has been shown to lower zonulin levels and help to heal a leaky gut. And there's a new probiotic out there called Akkermansia. Akkermansia is what they call an obligate anaerobe, so it can't live in oxygen. So it's been very difficult to put into a capsule, to try to get it out of the colon into a capsule, has always exposed it to oxygen, so it dies. There's one company now that is putting Akkermansia into a capsule. Previous to that, we were making what we called an Akkermansia shake. So we were putting different fibers and different components into a smoothie to help generate this particular bacteria that supports the mucus production in the epithelial cells. So I usually use one or more of these three, the Saccharomyces boulardii, one of the spore formers, and the Akkermansia to help with the GI support product, whether it's GI Balance or GI Revive or any of these others that have a good combination of these compounds, the glutamine, the S-acetyl glucosamine, et cetera. And sometimes, I'll add some extra butyric acid. So butyric acid is the food for the healthy bacteria. And there are a number of compounds that will, support, give more butyric acid. And I especially add this for people who are having a lot of brain fog. So we know that, if there's inflammation in the gut, if you have a breakdown in the gut barrier, you have a breakdown in the blood-brain barrier. So these two membranes are basically the same. One breaks down, the other breaks down. You have inflammation in the gut, you've got inflammation in the brain. And inflammation in the brain will affect neurotransmitters, will increase those cells we call microglia, and brain inflammation will be a major issue. Butyric acid has been shown to increase something called BDNF, brain-derived neurotropic factor. It supports reducing that brain inflammation. So, the protocol, you don't want to make it so that it's too complicated because compliance is always an issue, and many patients have already been taking, a half dozen or more different supplements twice a day. So, the ones that need more help, those are the ones you add more into, and you try to keep it simple for the ones that, may not need all of that. In terms of the reintroduction of food, so we want to start working on cleaning up the gut. And then after a couple of months, so I would say, I tell the patients at least 2 to 3 months of elimination of these +2, +3, +4 foods. And I actually add in on the second page of the report, where we see each one of these foods with a certain height of the bar. Anything close to the 2, I told them to eliminate those as well. So, I know it's been said that, if you do a repeat test, there's a level of 1, in terms of accuracy. So things that are totally negative could be 1+, a 1+ could be a 2+. So, things that are low down on the level in terms of the graph on the left, that they're close to like the 1 to 1.5, maybe eat them every couple of days or a couple of times a week. But anything that's close to the 2, like on this one, it looks like I can't see what that fourth number is, but that bar is getting to the point where, yeah, the one right next to the egg, looks like, yeah, this,
Milk.
right, sheep's milk.
Can you see that one okay now?
Yeah, so sheep's milk. So, I would tell them to keep, maybe take the sheep's milk out as well. Maybe also Brussels sprouts. So anything that's getting close to the 2, depending upon the severity of the inflammation, they may want to remove those as well. And then I also, if they have a casein sensitivity or a strong sensitivity to, sheep's milk or cow's milk, I take all the dairy out. Even, they say, well, why can't I have sheep's milk? It's not coming up. It's just the cow's milk. It's casein. Casein is casein. And, if you're having all of these inflammatory issues, you have total brain fog, you have no memory, you have no energy, you're not sleeping, you need to take them all out, and the same thing, if you have some weak gluten, I would be taking out all gluten grains. We do know that gliadin, which is, again, one of the major wheat proteins, increases zonulin. So, Alessio Fasano showed that if you give somebody gluten grains that has gliadin in it, it's going to increase zonulin. If you're increasing zonulin, then you're maintaining that leaky gut. That zonulin, I tell them, remember that you're taking that wrench and you're just unscrewing your bolt, you're unscrewing your tight junction. So, they need to be aware of that. Now, when they want to reintroduce the foods after a couple of months, I tell them go from the least reactive to the most reactive. So if casein is number, the +4 at the top of their list, they're not reintroducing that first. They go to the ones that are the high +1s and the high +2s. They're going to eat the food several times in one day. And then I tell them not to eat it again the next couple of days because these are delayed food reactions. So I get a lot of questions that patients say to me, I went to my allergist and they did all the allergy skin testing and I don't have any allergies. And I explained to them that those skin tests are IgE evaluations, and IgE measures an immediate type of reaction. You eat a strawberry, you get a high. If you eat peanuts, your throat closes up. We're not testing that. We're testing IgG reactions, which are delayed. These are delayed reactions, so you need to give each food at least 2 to 3 days, before you can say whether it's causing a problem or not. So they eat the food several times in one day, and then they keep a journal. They keep a diary. You have to write down anything that changes. It could be a bad mood. It could be a stomach ache. It could be loose stools. It could be a rash. It could be any change that they didn't see before. If it comes up, they're still sensitive to the food. And then they want to keep it out at least another couple of weeks, and then they could try it again.
Yeah, that's good advice. We did a study recently in China, and they took out the foods for a minimum of 3 months, and we saw an 82% improvement, and it was really very similar to the list of symptoms on this screen. So it was really all comers. And as I said, we saw like an 82% improvement on that patient population, and that was just from eliminating the foods. And I guess that kind of tallies pretty well, Dr. Allen. If you think about the 20% that you were seeing beforehand, if you then add supplementation to that, that gets you up there. And I think that was the interesting thing in terms of where we were, what we were seeing with that study. But and then the other thing I would always say with the IgE, when patients say, well, I think I've been tested for this before, it's always worth checking to make sure that we're not suggesting they reintroduce an allergy, in IgE. If the test wasn't done with you guys, it's worth checking that one out. But it's a key difference between the severity of response on the IgE versus what you see with the IgG, which we're testing here, in terms of the complement and IgG versus IgE reaction.
Yeah, and most of the older IgG tests, did not include C3D.
No.
And there is, some concern that a positive, separate IgG4, which was a lot of the tests were just IgG4 tests. IgG4 could be a blocking antibody. And you may see a positive result to IgG4, and you're actually not having a problem with it. It's actually blocking another immunological reaction. So the FIT test is much more complete in evaluating that entire immune system in its reaction to these foods. Now, another thing that we've seen over the last decade or so is, and you have it right here, autoimmune diseases. We've seen a huge uptick in the number of autoimmune diseases. Maybe 10 years ago, there were 80 defined autoimmune conditions, and now we've got, upwards of 150. So where is this coming from? Well, it's coming from environmental stressors and leaky gut. So the three main contributors to autoimmunity, usually there's a genetic tendency. Somebody in the family has maybe psoriasis or eczema or some other minor autoimmune condition. And then, we have these stressors. A stressor could be a food like gluten or dairy. It could be a virus, like COVID or Lyme disease. And then we need leaky gut. So, to put a dent in, the occurrence of autoimmunity, this becomes again the first step in dealing with that. A huge question I get from all of these patients who have seen so many different practitioners, and everyone from rheumatologists to neurologists and gastroenterologists, and they're all looking at their own little piece of the puzzle. It's like that, four blind men and the elephant, each trying to describe the elephant. They can't come up with a diagnosis, and the patient wants to know, well, what do I have? And I tell them, you don't have a diagnosis. There's no ICD-10 code for what you have. You have a chronic inflammation, with the associated leaky gut and environmental toxicity. Now, the environmental toxicity, I think, is extremely important, and we're all toxic. Every day you pick up the newspaper, there's another source of toxicity. I mean, just recently it was the forever chemicals, the PFAs that they found in almost half the drinking water in the world. Before that, they were looking at nanoparticles of plastics in coronary blood vessels. They had no idea how to get them out and what they're going to do. So everybody is toxic, and then there's mold toxicity. So with all the climate change and wet weather, it's been estimated that more than half the buildings in the country are water damaged. And we also have these wildfires from the, West Coast in Canada bringing, air that has mold in it, because these forests are not just burning down healthy trees, they're also burning down decaying trees. So we have all this toxicity. And what we know about this is that it affects the immune system, especially the innate immune system. So, I don't think that you could, effectively deal with all of these issues unless you address the toxicity piece as well. And you could argue, which one do you have to do first, the gut or the toxicity? I don't think it really, matters, but they both have to be done. So, very often, after I have somebody, work on the gut restoration piece, I'll start them on a detoxification protocol that will help to eliminate their environmental toxins.
What do you advise for testing for that toxicity, just out of interest?
Well, there are some.
You just moved to a detox.
Yeah, there are some blood tests that give some kind of indirect indicators. So there's another complement called C4A, and there's C3A. With environmental toxins, we generally see C4A go up, C3A may go down. There's a protein called transforming growth factor that has some very good evidence that it gets increased by mold toxicity. So a lot of my work has to do with women with a chronic condition of fibroid tumors of the uterus. And they're always inflamed and they always have leaky gut. So I was empirically working on all of that before the fit test. Now I'm much more, kind of specific in what I'm recommending. So it's really helped quite a bit in that. But this transforming growth factor, I became interested in it because, the studies show that when it's elevated, it increases fibrocystic changes in the breast, fibroid tumors in the uterus, fibrosis and scarring throughout the body. So some of it is necessary. I explained to patients that if you had a cut that had to heal, you need growth factor to grow the cells to heal the cut. But if you have too much growth factor, instead of a nice thin scar, you wind up with a thickened kind of keloid. So this can grow anything. If you Google it, you see autoimmunity, you see tumors of all kinds. And this is something that, you could do through Quest Labs. So the C4A I generally do through LabCorp, the transforming growth factor, and other things like matrix metalloproteinase 9 or MMP9. Leptin. Leptin is what they call the hormone of satiety. Basically tells your body when you've had enough to eat. But people become leptin resistant. They overeat, they gain weight because the cells are not listening to the leptin anymore. Like insulin resistance, the cells are not listening to insulin to get sugar out of the bloodstream. But leptin will also go up with environmental toxicity. So I do any patient who comes in with this, this list that you've just put up here, I'm going to do these toxicity indicators. And then I will treat them based upon that. Now, I'm pretty confident that these are indicators of mold toxicity because there is a urine test that we can still do in New York from a company called Real Time. It's a simple urine test. We do use some glutathione for 2 weeks to help mobilize toxins. Otherwise, they're stored in the liver cell and you may get a false negative test. So you mobilize the toxin for 2 weeks using glutathione, and then you collect some urine. And and Medicare covers this test for some reason. I don't know why they do what they do, but they do cover this test. And so I do it on Medicare patients. And when they have this picture of toxicity on the indirect blood testing, they always have mold. So they check about 8 different mold toxins. They're going to have 1 or more mold toxins. So I'm pretty confident that in a younger person, if they don't want to do the urine test, that they have mold. And after we do this initial cleanse, which is going to close the gut barrier, it's going to upregulate detox pathways. It's going to start lowering inflammation. Then we segue into this further detoxification protocol using binders, zeolite or bentonite clay, activated charcoal, glutathione to help move these toxins. So that would be a way of starting to lower that toxic burden. I recommend things like infrared sauna, because, to age, and I'm not an anti-aging person. I don't believe in anti-aging, but I do believe in optimal aging. And as I said initially, to me, that's all about lowering the toxic burden and keeping inflammation as low as you can. Now, I briefly mentioned earlier the 4R program, which is removing the foods or the stressors, replace. So many of these people who are so stressed out, they're affecting their very important vagus nerve. So 12 cranial nerves, the 10th cranial nerve is the vagus nerve. We know this is the superhighway between the gut and the brain. So what's going on in the gut gets up into the brain via the vagus and down again via the vagus. But the vagus nerve gets shut down under stress, and people have digestive issues. They don't make stomach acid. They don't put out pancreatic enzymes. So replace would be putting back these acid and enzymes, maybe supporting bile function as well. Reinoculating, we want to bring back the healthy bacteria. and repair. We talked about repairing the leaky gut. And then rebalance became the 4R program became the 5R program when they added rebalance. So rebalancing is, acknowledging that mind-body connection and looking at where the stressors are in a person's life and what they can do, to lower the negative effects of stress. Sometimes we can't get rid of the stress, but we could do things to reduce the impact of that stress. So I teach people, I don't teach them, TM, transcendental meditation, but I teach people how to be in the moment, how to find more moments of not worrying, not regretting, of being grateful for what they have in the moment. So that expression, stop and smell the roses, stop thinking, stop worrying, appreciate what's around you. So that's the rebalance part of it, getting them to move their bodies, to exercise, to stretch. Probably one of the main indicators of optimal health of your biological age is your lean muscle mass. And, so many people, you ask somebody if they're exercising, yeah, they say I walk my dog every day, but that's not building up lean muscle mass, and they're not stretching. I used to have an 80-year-old yoga instructor who said, you don't get old and stiff, you get stiff, and then you're old. So we need to be moving our bodies regularly. We need to learn how to eat, so the standard American diet is, it's sad. That's what it is, standard American diet. So we need to educate people to, get rid of the processed foods, to, decrease the sugar, decrease the salt, um, you know, cut back or cut out alcohol. Alcohol is just showing itself to be more and more of an irritant. We know increased alcohol consumption increases colon cancer, so I don't know how it would be not affecting the gut lining itself. World Health Organization used to say for men, 10 drinks a week was okay and 5 for women. And recent meta-analysis, they've come out and said they can't come up with a safe level any longer. So, the rebalance part of the 5R program, if you can get people working on rebalancing and kind of loving themselves and nurturing themselves, then you have a really good chance of them not falling back into the dysfunction, the disequilibrium that they came to you in the first place for.
That was that was a great analogy. That was fantastic. So, the only question there's quite a few questions here, but I think you've answered most of them. Is there any specific group that you found? I know that you've got an overwhelming group of women that you've been treating in terms of with the fibrosis, but is there any other group that you found particularly, or is it just that's your general go-to and then it's kind of worked off there?
No, like I said, I see people with inflammation of all kinds. I just saw one woman yesterday, who came in. She's talking to me about the Ozempic type medications because she's not able to lose weight. She's still fatigued. She still has a bit of brain fog. And we talked about all her different issues, but she said to me as she was leaving, I just want to thank you so much for doing that Fit Food panel, because I had this symptom of just tingling in my hands, tingling and numbness in my hands. And I saw so many doctors, it never went away. As soon as I eliminated the foods on that panel, it's gone. So, this is the kind of thing I hear. There are these, kind of weird kinds of symptoms. They don't fit into any kind of pattern. They don't, fit into any kind of disease or ICD-10 code. And these patients are just kind of shuffled off on the wayside because if you don't have an ICD-10 code, you don't have a medication to fix it, and you don't have anything that you can't get reimbursed. You can't, charge the insurance company. So they get really just shuffled away. But a test like this can help to pick up these weird kinds of symptoms that people have. This is their body's response to their inflammation. And we all have our kind of weak spots, and that's where it's going to go to. So, my own wife who did the test, she was having severe eczema rash. Nothing was taking care of it. All the creams, nothing was helping. It was really annoying every night, to the point of she was bleeding from scratching it. As soon as she eliminated, and the foods that were on her panel were the foods that she was eating regularly. And they were healthy foods. I mean, Priscilla is, mostly vegetarian, eats only healthy things, but things like lentils, which she ate a lot of, or flax seeds, which she ate a lot of. These came out on her panel and she eliminated it, and she's not had a problem since.
Yeah.
So, I think that, this test is really something that could help reduce a lot of these symptoms that there's just not a good reason for, that are falling through the cracks. And it's, pointing us in a direction of helping these people to achieve, some kind of health when they've been so sick before. So, I see people with chronic Lyme disease. I see people, who have chronic fatigue syndromes. I see a lot of people who have some kind of severe autoimmunity, like lupus or rheumatoid arthritis. So I'm seeing, all of these kinds of people, that you've got kind of listed here.
Yeah.
And I would say that they're all benefiting. I've not seen one, maybe it's just that they have less bloating, or maybe they have, more regular bowel movements. Some are getting, significant improvements, and they have more energy. They have better state of mind. But I've not seen one patient yet who didn't get some kind of benefit by eliminating the foods that they're showing reactions to.
Let me just give you one last question, because we've got Yasmin Curtis Smith here. Would a patient who has IBD, e.g. Crohn's, will always score positive for leaky gut, or would following a 5R and food sensitivities eradicate it?
I've seen it eradicated. So I do have a patient with UC, ulcerative colitis, who's lowered her medications. She's feeling much better. She's, trying to get off medication completely, not yet, but she's lowered her medications, and on the gut barrier panel, she's closed up. She is not showing any of the indicators. So, you could have a patient with IBD and, severe gut dysbiosis and leaky gut, and you could have somebody who's in remission. And these people who are in remission do not have leaky gut, and you could help them get into remission by taking away the triggers and then supporting the healing of the gut.
That's great.
So that's what I've seen.
Well, I know people tell me that, an hour is an hour, but that hour's just flown by. So all I can tell you is thank you so much for your time and your amazing insights into not only how you use the test, but again, your overall concepts of how you're running the practice, and the wonderful work you're doing in terms of, that for all your patients and for all of us who've had the privilege to listen to you over the last 45 minutes to an hour. So thank you very much indeed for your time. I hope no one was too upset we didn't have lots of slides yet to find. It's a bit like asking a provider, do you mind if I do your meal plan? I'm sure, but the idea is we want to make sure that this was a wonderful opportunity to listen to someone with a lot of years experience and many more to come. And thank you very much, Dr. Allen, for your time, and everyone for tuning in.
And thank you so much, James, for all your work and for making me look good. Right?
No, not at all. Thank you very much indeed. My
Thank
pleasure.
you too.
All right, cheerio.
Bye-bye.